geriatric pregnancy is another really horrible term for it, where, women hear this number and they're like, oh my gosh, it's almost like this fear that at 35, all of a sudden things are going to fall off a cliff and you're going to have, no ability to get pregnant. You're going to have a horrible pregnancy. And that really isn't the case. Age is a factor, but it is only really one factor.
Hello and welcome back. Today we are talking about something that is near and dear to my heart, and that is fertility when you're getting a little bit older in your fertile years. This is something that a lot of women are thinking about as our culture has shifted to be having babies later in life. This can apply to women whether they're actively trying to get pregnant or just planning ahead. And this specifically is looking at getting pregnant in your late 30s, early 40s. I record this as I am currently pregnant with my fourth in my 40s. So this, like I said, is very personal to me. There is so much noise out there on TikTok and Instagram, things that are making you really scared to get pregnant, but also maybe some things that aren't clear enough. And today we're talking with a very special guest, Dr. Miranda Naylor. She is a functional medicine physician who specializes in women's health, hormones, and fertility. And she brings a really thoughtful, whole person approach to care, which blends her conventional training along with an understanding of how functional medicine and lifestyle, functional testing, root cause work can support fertility at any stage of life. We're specifically going to cover why ovarian aging and diminished ovarian reserve are a little more nuanced than just you're running out of eggs and this is what you're stuck with. We're also going to explain specifically what's going on physiologically as we age and how to possibly slow it down and how to support fertility before you're ready to conceive. We also talk about what you can do in your late 30s, early 40s if you're trying right now. So please tune in if this is relevant to you or if you know someone who this is relevant to. We're also going to be talking about male factor fertility. So send this to the man who may be also trying to help that woman get pregnant. We're talking about non-negotiables for optimizing fertility. If you enjoy this episode, we would love to hear from you. Please leave us a message and subscribe, send us a DM, whatever it takes to help us make this podcast as helpful for you as possible. We'd love to hear from you. Now let's get started.
It's never a bad time to start working on fertility, even if it's like, yeah, I think I want to have kids one day, but it's really not on my radar at all right now. Still doing things to support your overall health now is going to support the longevity of your fertility.
Well, Dr. Naylor, thank you for coming on. I am super excited about this topic today because this is something that I feel like there's not a ton of information about out there. So thanks for sharing your fertility expertise today.
Yeah, my pleasure. Happy to be here.
Well, so specifically, we're talking about advanced maternal age, but also what we call diminished ovarian reserve, or sort of what to do when you're trying to get pregnant and those ovaries are not acting as youthful as they should or as they once did. Before we get to that, tell us a little bit about your journey because you treat fertility from a functional medicine lens. What transpired to lead you to this place?
Yeah. Well, in family medicine residency, I'm a conventionally trained doc, and in my residency in family medicine, I decided that was a great time to start a family. In retrospect, I was like, why was I thinking that at the time during this very stressful time in my life? But it seems like a good time. I stopped taking birth control and I didn't have a period. And I was there stuck in the patient side of things going, wait, what's going on? What's wrong with my fertility? Why am I not getting a period back? And the conventional approach was very lacking in providing answers. And I suddenly saw it from both sides. Wow, as a doctor, I'm really limited in what I could do in this situation. And as a patient, I'm really dissatisfied with not having answers, not knowing how I can best support my body. I really wanted to be proactive and do something rather than just sit around and wait. So that was my really big aha moment. It was also at the time of just treating people in a hospital where the conventional approach, I just saw them coming through as this mill and they weren't getting better. And so I was already feeling really inspired to look at a better way. That's when I learned about functional medicine. I was really like, wow, this makes a lot of sense. Yeah. And so I put those two things together to say, how can we better support women's health, especially, and fertility with functional medicine? And they just tie together so beautifully that's where my professional journey began.
I love it. And now you're really committed, you're all in with women's health and specifically fertility with your clinic. Obviously, one of these issues, like we talked about, one of the issues that comes up with women having babies is the idea of, in our culture and across the world, people getting pregnant, women getting pregnant a little bit older in their lives. And I am, you can call me an older mom. Our first baby was born when I was 35, and I'm my mom's youngest, and she had me at 35. So there's definitely a cultural shift of us having babies later. And I always chuckle because I get patients who come to me and are like, I want to make sure I get my kids here before I'm too old. And it used to be that patients would say, like, I can't have babies. I'm 35, and I'm sitting there, very pregnant at 35, and then 38, and then 41. And another question that I hear from patients a lot is, when is the safest time for me to have babies? Or is it safe to have babies after the age of 35 or the age of 40? And again, I'm pregnant now with my fourth, and I'm 44. And so it's funny for me when patients ask that. And I'm like, you might be talking to the wrong person, because I am that older mom. So this is a topic that's near and dear to my heart. Tell us about your experience with this, about why this is an issue. Even just start from the very basic about why are people even concerned about fertility, as we'll start with aging, and then we'll kind of expand that to diminished ovarian reserve, because that is not necessarily the same thing. But tell us why this is even a topic, and should patients be concerned about it?
Yeah, well, you're absolutely right. There is this big cultural shift where a lot of women and a lot of couples want to maybe focus on their career first. They have other things in mind before they want to have a family. And, with that, there can be a little bit harder time with couples getting pregnant. Also, there are other things going on in our world that have changed fertility in general.
Yeah.
So I think there's a lot more concern for people. They have friends or family who have had struggles with fertility. And so a lot more people are aware of it, which is great in a lot of ways. But there is this worry too. And especially there's sort of like this magic line in the sand at 35, where all of a sudden you are of advanced maternal age, or, geriatric pregnancy is another really horrible term for it, where, women hear this number and they're like, oh my gosh, it's almost like this fear that at 35, all of a sudden things are going to fall off a cliff, and you're going to have, no ability to get pregnant. You're going to have a horrible pregnancy. And that really isn't the case. Age is a factor, but it is only really one factor. And there's so many other things that go behind even why aging is the factor.
Absolutely. And I think it is good to talk about, because in certain communities on social media and such, I think people dismiss the idea of age being a factor, right? Like, you can get pregnant anytime, or there's no problem. And the fact is that complications with pregnancy do start to go up a little bit as we age. And we won't get into that a lot, but some of those complications, like miscarriage, for example, they do go up as we age. Can you explain just a little bit about what the idea is with the ovaries aging? Because I think that helps us understand some of the issues with fertility, and potentially with that increased risk of miscarriage as our ovaries get a little tired out.
I love the way you put that. Yeah, absolutely. I mean, one of the things that is most commonly talked about is the idea of running out of eggs. Yes. It is true. We're even before we're born, we have something like 6 to 7 million egg cells. That even goes down to 1 to 2 million at birth. From there, it just goes down and down and down. And especially once we start ovulating at puberty, that's about like 300 to 500,000. It goes down to about 100 to 150,000 at age 30. And, from there is dropping significantly. Again, through ovulation, we're losing egg cells. They also die off naturally. It's part of the normal process. And that becomes, again, more accelerated depending on some other factors that go along with egg aging. So that's where part of it comes up. Again, like age as, a factor with that natural process of losing eggs over time. And that can be a little bit faster for certain people compared to others. There's also just the wear and tear on our cells in general that also affects our egg cells. And that can be another factor with how quickly, again, our eggs are aging, and maybe how many issues they can have. Like, basically the health of the egg cells becomes a factor, especially in those older years. Again, hate using these older years, but like 35 on, it absolutely is possible to get pregnant and have a healthy pregnancy, but there is a higher risk of pregnancy loss and of, not being able to get pregnant, because those egg cells, while they might still be plentiful enough, they might have more damage to them where they're not able to come together and create a healthy embryo or healthy baby as well as they could have before.
Yeah, a lot of this is just sort of normal wear and tear on the body or excessive wear and tear on the body. And the more that we are doing that ages our bodies, that has more wear and tear in our body, then those ovaries are going to be more sensitive. Those egg cells are going to be more sensitive than a lot of our other cell types. Skin cells are another one that are they're pretty good at showing us how well our body is aging, right? If our body is aging quite rapidly, the skin is one of the first places to show. You'll get more wrinkles and the skin will be a little more crepey and a little more thin. Whereas when we're taking really good care of our bodies, the skin can be really robust and bouncy and all of these things. And the skin and egg cells and a couple other cell types are those really, really sensitive ones that kind of shout out to us when they're like, we're not okay right now.
Yeah.
Tell us about diminished ovarian reserve as it relates to younger women. Is there anything else we need to say about that may be different than just natural aging?
Yeah, so diminished ovarian reserve is basically where we're having a low reserve of eggs, which are basically those, premature eggs that are going to then be able to be recruited and developed and maybe ovulate. So basically having a diminished number of those reserve eggs. And there, again, some different factors that can go into this. Typically, this is, for people who aren't familiar with this, before 40 typically is when this would show up. And it's also called things like premature aging or premature ovarian insufficiency, which is maybe a better term to really describe what's happening. And there are some factors that we don't fully understand. There are some genetic factors that go into that. And again, that aging process where, like we said, it's not just aging as a number, it's that biological age of those things that our body's exposed to. And, the oxidative stress we're exposed to, the damage that our mitochondria are under, if we're exposed to a lot of toxins, smoking, alcohol, things like radiation and chemotherapy, chronic stress, which is one that I like to highlight because a lot of us are living under chronic stress and many of us may manage it well, but that can be a huge factor. It isn't everything. People don't have to, think all is lost if they have some stress going on, but that can be a big factor, as well as just a poor diet, insulin resistance, inflammation, autoimmunity can be another big factor here that can, again, create that extra wear and tear on the ovaries.
So how do we know the state of the ovaries? How can we evaluate how our ovaries are doing? Are they aging well? Are they aging more rapidly than they should?
Yeah, that's a great question. Unfortunately, we don't have a direct view, right? We can't just put them under a microscope and see how they're doing. So we have to sort of infer from other, data. One, I love that you described that, like looking at our skin, looking at our health overall, how energetic are we feeling? What does our typical diet and lifestyle look like? That can give us some idea. We can also do some testing, even just basic markers like looking at insulin levels, looking at a hemoglobin A1C and blood sugar, inflammation levels. I like to do a high sensitivity CRP. Those can give us a great idea about, is our body under maybe some extra wear and tear? You can also do more advanced functional testing like organic acid testing, which can give us an idea about oxidative stress and can actually look at if our DNA is being damaged more quickly than it should be. And that can be really helpful to then compare that to our antioxidant levels and really see where's our balance. If we're completely out of balance, then we have a higher concern for there being more damage. And toxin levels can be great to look at here too, because again, if we're seeing a high toxic burden, if we're seeing something like heavy metals being really high or being really deficient in certain nutrients that helps us combat those things, then we know that there's very likely a higher level of that aging process.
Yeah. Okay. Wonderful. I think we should mention too a couple just routine blood tests like an FSH and an estradiol, an anti-Mullerian hormone. Will you touch on those as well? How those come into play? Because oftentimes that's already been done and people already kind of come knowing that. But tell us what that adds to the picture.
Yeah. So looking at some of those hormones can be really helpful too. So FSH, a follicle stimulating hormone, is that hormone that's recruiting those eggs to then become, to then ovulate. And that does start to creep up when we're getting into, typically for the normal person, into perimenopause, and more so like mid to late perimenopause. And that's the one that I do like to do for everyone, sort of screening for. And if we're seeing that even being above 10 to 15, I'm getting suspicious if that's in a younger person, because that shouldn't be that high, at least around like day 3 to 5 of their cycle. So that should be a very baseline time where it's below that. LH as well should not be elevated unless someone is about to ovulate. Otherwise, it should really be low for most women. And so if that's starting to creep up, then that can be a really big warning sign. And AMH is anti-Mullerian hormone. This is a hormone that is also produced in the ovaries that is part of the ovulation process. And this can be an indicator of ovarian reserve. It's kind of like the most common one. And there are factors that affect it outside of just the number of eggs that we have. But that's another one where it gradually declines with age. And if that number is way lower than we're expecting it to be, and especially if there are other factors that can affect that, like vitamin D, for example, if that's in line, but the AMH is still really low, then we know that we have a heightened concern about that.
Now, in the conventional medical community, it's generally considered to be irreversible, that like once your ovaries start to age, then you're out of luck. What is the general feel in the functional medicine community? How accurate is that? Because again, I think you can find some definitely social media accounts and other coaches and such who will say like, oh, no way. But the answer is probably a little more nuanced.
It is. Yeah. It's sort of in the middle of that, as most things end up being. It is a warning sign. It is a decline that is faster than normal. It's not to say that it's all over and you can't get pregnant at all after that, but it is the one thing that's saying, okay, your clock is going a little bit faster than other people's.
Yeah.
And while we don't have a crystal ball to say, oh, it's just 1 year or 2 years, we know that if certain numbers are at a certain place, then, we have much less time than they might have otherwise. But there are things that can definitely help that. And some of those things I think we're going to talk about today where, anyone can help sort of preserve their fertility in a sense. And even those people with diminished ovarian reserve or premature ovarian insufficiency, they can do things to prolong things a little bit to help their chances in getting pregnant, whether they're trying naturally or using something like IVF.
I'll go back to what you said earlier, which is we really don't have a perfect way to evaluate ovarian reserve. I totally agree with everything you've said. I remember, this is kind of a tangent, but I remember an episode of that show, New Girl, which is old now, and one of the characters on there went and they were going to test their ovarian quality, right? And number one, I'm glad that this is getting out and that it's coming to the forefront, but it's just the perfect social example of like real life for a lot of us is like, well, I'm thinking about having a baby, but like, am I okay with that? And they had on the show, one of the characters was great, no problem. And the other one suddenly found out that her ovarian reserve was really, really poor. And I'll say it kind of goes both ways. Like I think people should be conscious of it, but we really don't have a transparent enough single look at the ovary to be able for you to come in and be like, how's my ovarian reserve? And for us to know 100%, here's what your ovarian reserve is. So I like the idea of testing, and I like the idea of getting an idea of how our ovaries are doing, and it's imperfect. So I certainly wouldn't have someone panic if they're getting testing done, unless they're also, skipping periods and having hot flashes and night sweats and all of that. Like that definitely brings it a little more to the forefront that your ovaries are full on like shutting down. But if someone's cycling regularly, then the rest of those tests are to help us kind of risk stratify to say, let's maybe see if we can shape things up a bit. Let's see if we can slow your body's stress and strain a little bit better. Anything you want to add to that?
Yeah, well, I was just going to say, again, with AMH, you're absolutely right. It's like we think it's, this is our insight into our egg numbers that we have left, and it's absolutely not perfect testing. Something that I always remind people is, for one, one number doesn't mean enough, especially if there are factors that we're seeing that maybe this is affecting it, maybe we retest it. It also depends on the timing in your cycle when you're doing it. That can change, So not maybe jumping to conclusions with one number, and really looking at the whole picture and making sure that you're working with someone who is really well educated and familiar with this, so that you're being treated appropriately. For one, they're not, putting you into treatments that you don't need maybe, and maybe like jumping on the fear even more, but then also really giving you the support you need so that you don't maybe miss the window that you have.
Well, let's start with one patient scenario, and that's a patient who is, married or unmarried or whatever, but she wants to start having babies. She's 34, 35, not quite ready today, thinking about it in the next few years, and comes to you saying, I really want to make sure I'm doing everything I can to support my fertility because I know I'm going to be having babies sort of on the later end of my childbearing years, so to speak. Let's see how many different ways we can talk around getting old and having babies, but it's really it's words matter. So she comes to you and she says, I want to do everything I can. How are you evaluating her, and how are you walking through that with her?
Yeah. Well, I love this type of patient. I have a lot of these types of patients. And yeah, I think it's a great time actually to be thinking about things and just saying, hey, maybe checking in, seeing what the status of your health is at this point, and then doing things to support your health. First and foremost, the foundations of our health are always going to be the most important start. So if you are totally stressed out, you're not sleeping well, you're not nourishing your body appropriately, you're not moving appropriately, those are going to be factors that we want to talk about and make sure that those are dialed in, because those, while we like to take them for granted, are really the most important factors when it comes to our overall health and preserving our fertility, really helping with that longevity of our fertility. So those are always going to be first and foremost, as boring as they are. Again, maybe doing some testing to see where someone is with their health, and then maybe dialing in certain things. Again, are you really low in vitamin D or iron? Some of these very basic, easy to replenish things, making sure that, those are, there aren't some warning signs if you are insulin resistant or, really thrown off in some way in your health, maybe making sure that's dialed in. And then when it comes to nutrition, really making sure that antioxidants are the forefront. So typically I'll recommend a Mediterranean type diet where it's really focusing on whole, fresh foods, getting a lot of color. All of those different colors from plants are different types of antioxidants. So really trying to make sure that you're getting all those good things in to, again, combat the things that are happening to our body, the wear and tear that's happening, getting those good antioxidants in. And then again, filling in the gaps in nutrients. There are certain ones that we can test for and really see. There are also ones that we just know are really common, like magnesium, for example. So making sure that those are being well supported in the diet, but then maybe, having a good prenatal on board or something simple that can, give them some good nutrients in addition, where it can be really hard to get through our diet.
When it comes to prenatals, I'm really picky, and Needed is the one that I personally use and love. It's the brand we recommend most often at Uplift for Her because it is so intelligently formulated. It's formulated with the right forms and optimal doses of nutrients your body actually needs before, during, and after pregnancy. From their complete prenatal vitamin to omega-3s, collagen, and other essentials, Needed covers so much more than the standard prenatal, and it's all clean, well-sourced, and easy to absorb, so I don't have to worry too much about what they're putting in it. I can just trust that they're making a great quality product. When I first started taking the comprehensive prenatal vitamin, it was a lot of capsules, but I felt so much better after a short period of time and really think that it was a huge game changer with the amount of energy and feeling like I've been able to stay going during pregnancy and feeling well. Needed also makes a really smart product, which is their powdered prenatal vitamin. So for people who have terrible morning sickness in the early stages of pregnancy that just cannot do capsules, they have a powder alternative that tastes good and can be thrown into water or a smoothie. I just think it's so smart. Why did we not have this before? And then they also have a smaller dose prenatal vitamin, so you don't have to have all the capsules, that just covers the essentials. And that's another really good help for the beginning of pregnancy. So if you're interested, you can get 20% off your first order with our affiliate link, which is in the show notes, or you can find it on our favorite products page at upliftforher.com. Now back to the show. Yeah, I love that you bring up antioxidants because I think a lot of times we think about what you shouldn't be doing, like make sure not to use those, non-stickware, and I'm not knocking that, but oftentimes we kind of miss the boat on the very basics, and I think underestimate the body's ability just to repair itself and to be sturdy and resilient. I think oftentimes the body starts to break down because we have lack of repair mechanisms in addition to extra insults. And we think about removing the insults, but we don't add the extra repair mechanisms. And those antioxidants are what help our bodies repair. So when we talk about food and diet, there's so many different recommendations and so many different dietary approaches. And it can get really confusing of like, wait, I thought that was good for me, or I thought that was bad for me. And it's important to know what we're trying to target. So for you, what you're saying is to really support the body's healthy aging, and that includes the ovaries, and healthy repair mechanisms to make sure that as we go through natural wear and tear, the body is replacing those tissues with the healthiest tissues possible. Antioxidants are king, and we get those primarily through those really bright and colorful foods. So I'm glad you brought that up in addition to everything else. So you've walked them through the foundations. Where are you going next with this person?
Yeah. So again, when someone's coming to me, I do functional medicine. So of course, we're going to talk about the functional medicine things. We're going to start with the foundations. We're going to do some testing again to get a really good idea of what their health looks like. And that can start with very simple tests also. Usually we're going beyond what is done during a basic physical, but including those, maybe being a little bit more comprehensive. And then again, treating those things that we are seeing as sort of a red flag or a warning sign, something that could impact their fertility in the future, even if that's not what they're doing right then.
Yeah.
Being proactive. I love that you brought up, all the toxin exposures and really trying to limit that. That is a huge piece of it because we are exposed to so many more things. So when you have control over certain things, like the products that you're choosing, the cleaners that you're using in your household, it is important to try to limit what you can. But again, going beyond that too, to really working on your repair. And it can be helpful here too, to go back to testing, to test both male and female. This is really important when we're trying to conceive, but even beforehand in the preconception phase, this can be great for a couple to do together. And again, get a good baseline. A sperm test is pretty easy to do. Most men still, complain about it a little bit. They don't love it. It's kind of awkward, but they can be done from home nowadays. And that can be really great because it is for men, it's a lot easier to see exactly what those cells look like. And it can be a great time to see, oh, wow, I do have something that's affecting, my cellular health. What can I do about it now? And even if you're not ready to conceive at the moment, it can be great. And it's even actually more advantageous to do it ahead of time. So those are great things to look at and start affecting.
Okay, awesome. And all of the things that you're talking about for women to do with the antioxidants and the Mediterranean diet and eating for healthy blood sugar, decreasing toxins, those are all the same things that men do to support their sperm. Is there anything else men can do to support their sperm as they age?
Yeah. So for men, another factor comes in and it's their testes. Basically, the testicles hang for a reason, and heat, exposure, and other types of damage can also really impact sperm health. So this is more so important when they're actively trying to conceive. In the 3-month window before they're trying to conceive, they should really be avoiding saunas. They should be avoiding biking and direct, trauma to the testicles, basically. Cold exposure can be on the opposite of that and can actually help with this. But that shouldn't have a long-term impact beforehand if they're just, trying to, start working on their health before conceiving. The big things like, to go along with toxins, also using drugs and alcohol and smoking, those are things that could potentially have a longer-term impact. And so starting to wind those down earlier can be really helpful.
Well, let's shift gears a little bit then to the patient who is maybe 35 and beyond and struggling to get pregnant. Maybe her FSH is a little bit elevated, or she's starting to show some signs that maybe her body is not easily getting pregnant. What is your workup with them? What is your approach? How does it differ from what you've just mentioned?
So a lot of it is very similar, but we're really dialing things up to get a little bit more aggressive because again, the time frame has changed. And usually when they are coming in that time, they're feeling like either they wanted to get pregnant 2 years ago, and so already every day that they spend not pregnant is like too long, or they are concerned, okay, but I'm 40 now, I am healthy, but 41 feels like so, like it's going to get harder every year. And so there really is more of a time crunch. And so it's definitely bumping things up. It's making sure that those foundations are really, really solid, and then building up their antioxidant support even beyond that, really using supplements, because it can, and for anyone, again, it can be really hard to get everything we need through diet. And so really bumping up those antioxidants using things like CoQ10, alpha lipoic acid, PQQ. There's some other ones that are out there now, like urolithin A, which is really exciting. So really getting those good antioxidants in to purposely almost like use them like a treatment to really try to counteract that wear and tear that their body has already been under.
Where do you go next? Are there any other functional testing or any other functional medicine approaches that you're taking beyond the antioxidants you mentioned?
Yeah. Yeah. So again, a lot of the basic testing, we kind of mentioned a lot of those, the hormone testing and things like that are always going to be first and foremost. Doing functional testing, like organic acid testing, is another one that I rely on frequently because it gives us really targeted information to see like what is the oxidative stress numbers, their antioxidant levels, are they getting enough protein or not? Like there's a lot of really great information that we can get from that. I also like doing stool testing and looking at the quality of someone's gut because our microbiome can have a big impact. It's really like an entry point into our body. And so that can have a huge impact on our health and our fertility. So when someone is already, they're really concerned about their fertility, they really want to have the best approach, then we're looking there as well. I also like doing genetic testing, which, I think there's a lot of misconception about genetic testing where it's like, oh, it's just DNA, it's just set in stone. We can't do anything about it anyway. But there are genetic factors that we can change. It's called epigenetics, where we can turn on and off genes. And the way that we treat our body, the way that we eat and move, those can actually change the way our genes are being expressed. So that's another one that can be really helpful to see, okay, what factors do you have on board? There's some great panels out there too that are purposely for preconception to see, oh, do you have, risk factors for pregnancy loss or something like that, and then we can be even more targeted again with the nutrients they need to best support their unique body.
So go back a little bit because you mentioned some important words there. The idea of, you mentioned mitochondria earlier, and then you mentioned oxidative stress. What you're talking about there is cellular health, the individual cell, how are our cells? And this is especially important for fertility because the whole act of fertility is reliant on one egg cell and one sperm cell, and they are very susceptible to cellular damage. So maybe first go into a little bit of detail of what are cells particularly susceptible? You've mentioned a couple of these things, but when we're really getting down to the cell, what things are particularly harmful to a cell?
Yeah, great question. So, again, yeah, we mentioned those toxins and things like that, high blood sugar, inflammation. There are a lot of those things, even our immune system, again, autoimmunity and how inflamed it is, how responsive it is, those things can create inflammatory cytokines that then, impact our cells. Nutrients are also really important here where, even just again, we talk about that the exposure to the bad things, so to speak, but it's also like you were talking about our repair mechanisms, our ability to even have our cells function normally. That can be a big factor. And there are very simple things there too with how we can really support those mitochondria. The mitochondria too, to take that back, we think of that as like the powerhouse of our cells. They are the energy producers, but they're also these like sensitive cells that, or I should say organelles in our cells that can really sense our environment. So, if we're having a very stressful environment, if we're having a lot of toxins on board, they're sensitive to that. And even their ability to turn over and be really healthy can be impaired. And they are so important when it comes to getting pregnant. Mitochondria are in all of our cells, but they are especially concentrated in egg and sperm cells by exponential amounts because they are so important there. Mitochondria in the sperm cells, they're imperative to even get the sperm to be able to swim appropriately and get where it needs to be able to get into the egg cell. So we literally can't conceive without really healthy mitochondria. There are also, like I kind of mentioned, nutrients. Zinc is one mineral that is super important for this. I love talking about the zinc spark. A lot of people haven't ever heard of that.
Can you tell us more about it?
Yeah. So it's when the sperm is entering the egg cell, there is this flash of light that you can actually see on a high-powered microscope that is zinc having this reaction to allow the sperm to enter the cell and like have the DNA be shared and create this embryo. So it's literally the spark of life. And zinc can be really hard to get in our diet. With our Western diet, zinc is not very prevalent. And so little things like that can have a really, really big impact again on just how those cells in particular are able to function, how they're able to, unravel those DNA and bring them together appropriately. Those little steps in the process can be a big factor.
And these are things that are important for us at any age, but the longer we can do them, then the less damage there is to begin with, right? If we're eating a diet high in antioxidants and zinc and magnesium and B vitamins, if we're doing that for decades, then there's going to be less damage. There just is.
Exactly.
If we're eating a blood sugar balanced diet, there's going to be less damage. That idea of oxidative stress you mentioned, blood sugar is one of the biggest oxidative stressors there is for the cell. And the longer we can stay in that good zone, then the less repair we need to do last minute when we're trying to conceive. But if we haven't, then today's a great place to start, to say like, okay, let me stop stressing the cell with blood sugar and toxins, but then let's also add those repair mechanisms for the cell in antioxidants and nutrients and vitamins. I think one of the things that comes up a lot is the idea of taking mitochondrial supports. And you mentioned those, and they are great, but they're not going to outrun consistent, continued damage to the mitochondria. They're not that powerful. The mitochondria are very susceptible and very sensitive. And so if you're doing things that are damaging the mitochondria, then no supplements are really going to outstrip that. Now, if you've cut down on things that are damaging the mitochondria and you're stabilizing blood sugar and getting more light exposure, sleeping well, all of these things that are really good for our cells, then adding the mitochondrial support, I think then there is some definite improvement there. Anything you want to add about that?
Yeah, I completely agree. You can't out-supplement a bad diet or poor sleep or any of those things. And we want that. We want that magic pill that makes it so easy for us. We don't have to make any changes, but it just isn't going to be enough. But if there are factors where we're doing our best and we just can't be perfect, big obvious air quotes there, because there is no perfection when it comes to our health. We have a stressful job and we love it, but we can't, quit tomorrow and never work again. We can then do things to bump things up and really be able to work within the lifestyle that we have, the constraints that we have.
Now, you mentioned toxins a couple times. Will you go into that? What are the things that you really recommend someone who's trying to protect those little fragile egg cells or sperm cells from being damaged? What are the big things that we really know can be helpful and you really recommend patients making that investment of time or money to change in their lifestyle so that their cells can be protected?
Yeah. So to start with the big obvious ones, smoking cigarettes, obvious air pollution, trying to really avoid the chemicals that are obviously not good for you. When it has a horrible smell, you walk into a room and it's like a bad paint smell or those like cleaning fumes. Obviously, those are going to be the most obvious ones to remove. To get less obvious, and the things that we're exposed to very frequently are going to be our beauty products, our cleaning products, our detergents, and those types of things. Those oftentimes contain things like parabens and phthalates, which we know can be damaging. They can mess with our hormones and cause reproductive harm. Phthalates, typically we're talking about fragrance. So if someone's just starting off, removing fragrance or at least any synthetic fragrances from their products is a really important starting point. If it says perfume, if it has, any sort of fragrance on there that's a chemical that you don't understand what it is, most of the time it just says some fragrance and that's like the hidden chemical names behind that. Those are going to be things that you want to avoid for your general health. Plastics, as much as possible, avoiding those, especially for food and water. If it's going to be at any sort of, if it's going to be heated at all, really removing those. You mentioned nonstick coating on pans and cookware, the plastic utensils. Really trying to get all of that out of your kitchen can be really helpful. Going more for like stainless steel or cast iron can be a great one. Ceramic, some of those things, or glass for storage. Doing the switch for those can be really helpful. And then again, if there's something obvious, like you're exposed to, pesticides in your neighborhood because they're spraying regularly for that or something like that, really trying to modify how you can, maybe getting an air filter, getting a water filter can also be a big one. At least in our area here, we have terrible water quality. And so that's one that we're typically talking about. Like, where are you getting your water? Water is essential for detoxification and flushing things out. And if you have terrible things like arsenic coming in your water, like we have here, you're basically like poisoning yourself as you're trying to detox. So that can be a really helpful one that is a, worth the investment that comes with that.
You can look up the quality of your water in your area.
Yeah. So you can look up, and now I'm forgetting off the top of my head, I think it's like tap water database, but you can basically Google this and look up the quality of water in your area and just be able to see. You'll get a rundown of the things that are present and where it compares to the allowable limits of things. So that can be really enlightening to see, because it can be surprising. I'm in Southern California. We have mountains not far away. You'd think, oh yeah, our water should be good, and it's just really not. So yeah, that can be a great thing to do before you start worrying about it. And then again, maybe considering some level of water filter. There are very different levels, from Brita or simple water filter to a very robust whole house filter, or reverse osmosis filter. So sometimes landing in the middle can be really appropriate for a lot of people.
Well, I'm glad you say all that. I always have two minds about this, because I just am really sympathetic to the difficulty of this journey, having been on it myself and helped so many people through it. The idea of cutting everything out is super annoying, right?
Mm-hmm.
And I think there are people who are like, I'm not going to do that. I'm not going down that road. I don't want to think about it. I don't want to talk about it. And I totally empathize with that side of things. On the flip side, we know fertility rates are going down. We know that it's getting harder to get pregnant. And we know that, especially if the trend also is to try to get pregnant older, that wear and tear is going to start adding up. You're going to feel it earlier in your life. And so when I'm treating fertility, and I'm sure this is the same thing for you, it is a little bit of a time-sensitive issue, partially because of aging, but also just because it's emotionally difficult.
Mm-hmm.
It's really quite wearing on a couple to be trying constantly for every month for years to get pregnant, and then to see those negative pregnancy tests over and over, and your period's 2 days late. So you're sure this time it's real, and you take 5 pregnancy tests and they're all negative, and then your period starts. And it's exhausting and expensive on the soul. It's very draining on a couple and on the individual. And so when I'm working with couples for fertility, I've had to shift my approach a little bit, because I tend to be somewhat of a conservative person in nature, when it's like, well, let's try this thing, and then let's try this thing. And if that doesn't work, then we'll get a little more aggressive. With fertility, you kind of do have to go all in, especially if we're dealing with fertility in the later years of our fertile years. You don't have time. You don't have time to take a layered approach to say, let's do this for, 3 cycles, and then let's add this on, and then wait 3 more cycles, and then let's add this on and wait 3 more cycles. You really do have to go all in. And so I just want to draw attention to that, because it is frustrating, and I wish there was a different way, and I wish there were different answers. But the fact is, we know a lot about what could be causing infertility and difficulty with fertility and diminished ovarian reserve. We know a lot that could be trickling down and causing those effects, but we don't have time to try them one at a time. So you do kind of have to have a little bit of a sweeping approach. Now, if you're 21 and you're like, gosh, I'm listening to this and I want to preserve my fertility as long as I want, then do one thing at a time. Take your time and maybe focus on cosmetics first, and then cookware, and then all of these things. But I don't know. I just bring attention to that because I find it really annoying that it's so hard to do things the right way. That it can be really difficult to live in our culture and our climate and still take good care of ourselves. And yet here we are. This is the reality of it. The reality of it is, if we want to return to optimal fertility, we have to be quite aggressive about it, because those ovaries are real picky. They're real finicky little ones. So we just have to be kind of aggressive with it.
Yeah.
Will you share your thoughts on that? Because I know you can't avoid this when you're taking care of couples who are trying.
Yeah, you're so right. And I take a similar approach to you. I try to be conservative and really realistic. What do you need to change? I'm not the doctor who's putting every single person on a super restrictive diet. I think that's way overdone and unnecessary for a lot of people. But yeah, when it comes to fertility, it is really wearing. I love how you say it's expensive on our soul. Just like it's very tiring. It's very exhausting and very heartbreaking. And so we definitely do want to bump things up and really, get more aggressive, really do more things. And it's hard, even as a practitioner, it's finding that balance of, how can we still be strategic and work with the body in the best way that it's going to respond to things and not overwhelm the person? Because still it can be overwhelming if you're just throwing a bunch of really difficult to take supplements or, things that like the timing is complicated. It can be very overwhelming.
Yeah.
And so it's marrying that, like, okay, let's really get on top of things, but let's also be strategic too. And I always talk with people, what can you take on right now? Are you at a place that you can really shift things or not? It doesn't mean that if they're like, I really want to be pregnant, but I just can't take on that much. Doesn't mean you have to just not do anything then. We can still meet you where you are. But most people are very motivated to do a lot and make some major changes at this time, which is also very inspiring to me, to see just how dedicated people can really be with their health. But yeah, we want to make sure that we're not, wasting time, so to speak, or really, spending that time where they're just guessing. And one of my big goals is really, because it's hard, we can't guarantee pregnancy outcomes. We can't, guarantee that each person is going to, have exactly what they imagined. But what I really prioritize giving people is confidence and feeling really supported and held during the process, because that can just make it so much better and feel better on your soul when you're going through it and give you better outcomes.
Well, thank you for sharing that.
Yeah.
We're all about choosing products that will work with our bodies without causing harm to our bodies. That is why I want to share with you one of my favorite brands. This is a brand I use regularly and consistently in my own life and in my family, and it is Just Ingredients. From their electrolytes and probiotics to their protein and bone broth powders, every product is made with clean, simple ingredients you can actually pronounce and trust, without artificial sweeteners, no fillers, no junk, just real functional nutrition to support your energy, your gut, your hormones, and more. Our team uses these daily and recommends them often in clinic. If you're looking for products that align with your wellness goals, Just Ingredients is a great place to start. One of my favorite things about them is that I don't have to work very hard because they've already done the work. So I don't have to spend time looking at the labels and trying to find the ingredients, trying to remember what I was supposed to avoid. They just do that all for me. So I know anything that I buy from them is already screened and is something that I can trust. So use code UPLIFT for her for 10% off at justingredients.us. Now back to the show. When we go back to toxins, then you mentioned that long list of things that really we know can be harmful to our hormones and especially to our ovaries. What can we do to support our detoxification pathways besides just limiting our exposure to those things? What do we then do on the other side to say, can we get some of this moving through our body a little bit more to unburden the ovaries, so to speak, to help those cells be at their optimal state of health?
Yeah, great question. Because it's a two-part thing. And I'm always talking about that with people. It's, if we think about a funnel, it's what's going into the funnel, but it's also how large the opening at the bottom is with how quickly we can process things and get rid of them. So there's a lot we can do to support our natural detoxification. And it is a natural process that's happening all the time. We don't have to be doing a detox or cleanse all the time to have that happen. But because we're exposed to so many more things, typically, then giving a little bit more support can be helpful. Some of the things that we already talked about are really, really crucial here. So being well hydrated. Urination is one of the ways that we get toxins out of our body. So making sure that you're well hydrated, and especially with ideally clean filtered water. Making sure you're pooping well. Again, not a very sexy topic to think about or talk about, but that is another major way to get toxins out of your body. Yeah. So if you are kind of backed up, you're having inconsistent bowel movements, that's a big area that you could be holding onto toxins a lot longer than your body should be. Getting good protein in, good nutrients. We talked about that nourishing diet with, magnesium-rich foods and zinc-rich foods and B vitamins. Those all support our liver and different detox, levels of detoxification. And so making sure we're getting those nutrients so our body can function as optimally as possible. Those are amazing. And then again, the antioxidants and the different like bitter greens and cruciferous vegetables, which are like broccoli and cauliflower and Brussels sprouts, those sulfury smelling vegetables, those are incredibly helpful with supporting detoxification also. So those are little shifts that you can incorporate those into your diet. You can make sure that you're getting those regularly, and even just fiber in general, as well as fermented foods, getting those good probiotics, the good microbes to your gut. That can be really helpful in just your body being able to get rid of things. And to just name all of our detox pathways, sweating also, and well, sweating and breathing actually too. So taking some time to deep breathe, sweating. Again, maybe not when you're actively trying to conceive if you're a male, you don't want to be in the sauna, but still sweating through exercise, through hot baths. It's going to be really important for all people. And certain toxins go through these different pathways more. So especially, for example, if you have mold toxins on board, sweating is amazing to get those types out.
Awesome. I think one of the things that I see with patients is they'll say like, oh yeah, I do all of that. And so really being picky about, again, I tend to be more of a conservative, like, okay, if you think you're doing enough, but when we're really trying to get better and we're really trying to repair the body, we have to be a little bit picky about how aggressively we're doing that. And I think I don't know what you tell people for cruciferous vegetables, but cruciferous vegetables and the dark bitter greens, I mean, like 2 servings a day. And so when people say, oh, I eat a lot of broccoli, how often do you eat broccoli? Like once a week. We're talking about a lot more broccoli. It's a lot more, it's cauliflower with lunch and then broccoli with dinner, or Brussels sprouts next to your eggs, and spinach with your lunch. Like it's really a big amount. Do you have a different amount that you're recommending?
I mean, usually tell people at least 1 serving a day, but you're right,
Yeah.
like 2 even better. And I like to talk about the different ways you can get it in so they can kind of
Yeah.
wrap their head around it. We think like, oh, broccoli, like it's just steamed broccoli. It's like that is the only way, but that can get kind of boring. And so it is talking about the different types, how you can integrate them in. I actually just recently, I haven't tried it yet, but saw on Instagram a broccoli bread recipe. And I'm like,
Oh
cool,
yeah.
like that's amazing to get it in a different form. I love talking about sprouts too here, like broccoli sprouts. It's a great way to get those nutrients from it. They're even more potent in the sprout form, and they can feel a lot easier, especially for certain people. They maybe if they have gut stuff going on, they get bloated with eating a lot of veggies, especially cruciferous veggies. So doing sprouts can be great where they can digest it a little bit better also, but then get these really potent forms.
Well, that goes back to one thing that you mentioned earlier. I wanted to come back to one of the functional tests you mentioned was doing stool testing and looking at the gut and looking at gut health. Are there specific things that you're looking at with the gut when it comes to fertility per se? Like obviously everything about the gut should be optimized always. Like that's always what we're looking for. But is there a specific approach that's different when you're dealing with fertility?
Yeah, yeah. So like you said, I mean, all of the things are important, but there are a few things that we're especially looking at. One, with the microbiome, there are good bacteria, there are bad bacteria, there are yeast and all these different critters in there. And really making sure the balance is in a healthier pattern can be important. We also now have other microbiome testing, like vaginal microbiome, but our microbiomes sort of speak to each other. And so if we're seeing a big imbalance in the gut microbiome, we can be pretty sure that they're more prone to imbalance in other microbiomes in their body. So maybe more prone to skin infections, for example, vaginal yeast infections. And that can impact fertility. There are certain types of vaginal bacteria strains that can actually kill sperm. And, if there's inflammation there, that can be another factor too. And even now there's more research going into looking at the uterine microbiome. We used to think it was a sterile environment, but now we know that there are actually beneficial microbes there too. And so again, it can be a great place to start assessing the microbiome in stool testing. Another thing is inflammation, just seeing if there's a high amount of inflammation there. If so, we're much more concerned about inflammation systemically throughout the body, which like we talked about can just really increase that wear and tear on the body. We can also look at detox factors in the gut. So one is called beta-glucuronidase. It's an enzyme that's produced by some gut bacteria and can actually mess with detoxification in our gut, particularly of estrogen metabolites. And so looking at that can also be really helpful too, especially if someone is maybe in a higher estrogen state or they're having symptoms of higher estrogen. Seeing that, we're like, okay, now we're seeing, a factor in maybe they're having a harder time clearing out estrogens. So that can be really important as well.
That's great. I'm glad you brought up the vaginal microbiome because it just reminds me oftentimes when we see women, say she's 38 and she's trying to get pregnant for the first time and it's taking a while, oftentimes the first thing we're thinking is like, well, it's because you're getting old, right? Those old ovaries, they're just not what they used to be. And that's not necessarily the case. I think you've mentioned several things now. What we're specifically talking about is diminished ovarian reserve, but not all 38-year-olds have diminished ovarian reserve, right? I think there are some times when just because you are not 25 years old and you are struggling to get pregnant, it doesn't mean that it's because your ovaries are unhealthy. It could be that the vaginal microbiome is off. It could be that your tubes are blocked. We haven't even gone down that road, but
Yeah.
it could be your partner. Like oftentimes there's just this assumption like you are a woman over the age of 35, therefore your fertility issues are because of your age. And that's just not the case. We can still approach it from the perspective of a holistic approach to healing and supporting hormonal health and fertility, instead of just assuming that it's diminished ovarian reserve. Now, if the AMH is low and the FSH is high and the estrogen is low and you're having any symptoms of perimenopause and stuff like that, then it makes more sense to really target the lower ovarian reserve. But it's just, you can't really take anything for granted when we're dealing with fertility. And I'm going to come back around to it yet one more time that male fertility is at play here. So I don't care how old the woman is, it could still be the male. It could still be the male factor playing into it. And it's a waste of time to just be focusing on the woman over and over and over. If I have a fertility couple that's on the younger end and she's not ovulatory, then I may not test the male right away, although more and more I do anyway. But if she is ovulatory and things are at all looking okay with her, I want to know about him day one. I want to know about his metabolic health and his stress and his inflammatory symptoms and what his sperm look like. Instead of waiting until you've optimized everything you can with the woman and you're still not getting pregnant and then finding out that male factor is an issue. So I'm glad you bring up the vaginal microbiome and the gut microbiome to just show us that I think especially the gut microbiome can contribute to what appears to be diminished ovarian reserve with inflammation, but it also can just be an issue in and of itself.
Yeah. Yeah. I'm so glad you bring that up because absolutely the same fertility issues that can be for someone at a younger year could also be impacting here, especially if you've never tried before, you've never gotten pregnant before. There's nothing to say that it's not just endometriosis or something else, like you mentioned, a blocked tube that's actually the culprit. And unfortunately, the conventional approach, luckily, rather than making you wait for a year of trying to conceive, they only make you wait for 6 months at this age, but it's still very focused on age. And the conventional approach, doctors will be very quick to refer to IVF in the later years, and it might still not be successful because they could have one of those other issues going on. It is 50-50 when it comes to male and female fertility factors. It's actually a third female, a third male, and a third both. So it really, both partners are really important in the process. And unfortunately, even to this day, there's so much more focus on the female. It's like, because she's the one who's getting pregnant, she's the one who's carrying the baby. And when it comes down to it, even pregnancy loss is 50-50 with male and female factors, regardless of their age. So absolutely, it's very important to talk to both partners and be, ideally doing testing for both, at the least changing their lifestyles. So many, men are resistant too. Unfortunately, there's sort of this like air of, the masculinity comes in. And I think it's like, still thought that it's like not masculine to have something wrong with your sperm, but it is so common. And so if both partners can be a team in this and really make these changes together, do the testing together, their outcomes are going to be much better across the board. And most likely they'll save a lot of time and heartbreak.
Yeah, for sure. Are there any success stories that you can share with us? Anything that comes to mind of couples that you have seen this process work for, where you can address their foundations and address their inflammation and address their lifestyle and really see pregnancy happen?
Yeah, absolutely. I mean, I've had a number. If I can think of just one good example. Yeah, I mean, there was one couple in particular who kind of like fits this age group, where, late 30s, had been trying to conceive for a couple of years and it wasn't working. And it really, there were some factors as far as inflammation and things like that that needed to be addressed, but it was sort of like a perfect situation where we addressed the foundations. We did the testing. Again, we don't wait around to do the testing. We do it up front, address some things like some gut health things. And really quickly, even after a few years of trying with no success, it was like, I think it was, 4 months later or something like that, successful pregnancy. I think at this point, they now have another child. I think they've already had the second child also. And so it was just a great example of just how things can move smoothly. And it's not to say, to point out that on the other side, there are other couples who are doing everything right. And they're trying so hard and pouring everything into it.
Yeah.
And it's not coming around easily. And I think it's important to say that also, even though, I think a lot of practitioners don't want to talk about those. They want to talk about their success stories. But there are also people who we really don't know, unfortunately, still. We're looking at everything. We're treating the toxins. We're going deeper with testing. And it's still just really, we don't know why they're not getting pregnant naturally. And luckily, we do have other resources, like all the IVF process and IUI and things like that when we are stuck in that situation. But luckily for most people, they respond really well and are successful after doing these things.
Well, that was my next question. So I'm glad you brought it back to that. It does make it feel like if you do everything perfectly, then it will work. And as we know, anyone involved in any sort of aspect of pregnancy, people's bodies do whatever they want to do. They don't always play by the textbook. So it's important to not feel guilt or shame if it's not working. It's one of the things I tell, especially with my PCOS patients. I get PCOS patients, they've lost weight, they've managed insulin resistance, they've fixed the inflammation, and sometimes it still is just not coming online. And we do a little bit of fertility medication and they do great. And that's what I tell them, like you don't get a gold star if you manage to do this without fertility medication. Mm-hmm. But if we can get your body as healthy as we can get it and then tip you with, a little fertility support, then that's okay too. That means that we're still improving pregnancy outcomes and hopefully postpartum outcomes as well. So bodies don't always play by the rules.
Right. And it's not all or nothing. I think when we pigeonhole ourselves into thinking, we're just going to do it naturally, we're just going to be completely holistic, then we're missing out on opportunities that we have. So I agree. I don't recommend people just jump to IVF because it's not a guarantee. And, if the health of their body isn't in line, then all of the outcomes are likely to be poorer. But if they've done all the due diligence and they're like, I really can't take another, year of waiting and guessing. It's like, then do what's right for you,
Yeah.
So I'm glad you bring that up.
Well, we are out of time. Is there anything else that we've missed? Anything else you want to say as we finish up here?
I mean, I think we really covered everything. The thing I'll just go back to is, it's never a bad time to start working on your fertility, even if it's like, I think I want to have kids one day, but it's really not on my radar at all right now. Still doing things to support your overall health now is going to support the longevity of your fertility. So it's great when I have people come in earlier. I love to see that, and really, getting that going right off the bat is awesome.
Well, thank you so much, Miranda, for being here. Will you tell our listeners where they can find you?
Yeah. So I'm on Instagram at Dr. Miranda Naylor. You can go to my website at drmirandannaylor.com. I have some great resources there. I have my own podcast as well called Modern Women's Wellness. It's on all the podcast platforms.
Yeah, so wonderful.
Yeah. And on my website too, I have a free resource for a fertility nutrition guide. So that can be a great thing. We talked about a lot of the big things there, but that can be a great resource to really know how to build out your plate to best support your fertility. So that's on my website as well.
And where do you see patients?
So I'm in Encinitas, California, and I see patients in Solana Beach, California as well, and virtually.
Yeah, so only to California residents, or?
Yes, in terms of full medical care, but we do have some ability to do some health coaching outside of that. Yeah.
Awesome. Well, thank you again for being here. I think it's been hopefully a really helpful conversation for people.
Yeah, definitely my pleasure.
Thank you so much for tuning in to today's episode. A huge thank you to our guest for sharing their insights and time with us. We are grateful for the incredible support from our sponsors and to all of you listening. We couldn't do this without you. If you enjoyed this episode, please consider subscribing on your favorite platform. You can find us on our website, upliftforher.com, YouTube, Apple Podcasts, Spotify, or wherever you love to listen. And if you found value here today, please share this episode with someone who would benefit from it. Leave us a comment or give us a review. It really helps us reach more listeners like you. Thank you for being part of our community. Stay tuned for our next episode. Lastly, this information is for educational purposes only and not intended to be medical advice.